Our lovely patient, who is 59 years old, is 6 weeks out from her deep plane facelift under tumescent local anesthesia, and she comes in today for follow-up, and she's very graciously agreed to share some of her thoughts and feelings about what she was hoping to achieve, how she feels about her results, and what her entire experience was like.
So I decided to do this because I was getting a lot of weight in my neck and double chin and, genetic, and it was making me over time feel really self-conscious. And I realized there was no other procedure that was going to make it the difference that I wanted. So I came in and went ahead with the procedure. I decided to do the tumescent. I had some trepidation about that, but researched it at length and talked to Dr. Clater at length and went ahead with that. All my worries about having that done were completely unfounded. I would recommend it to anyone. It was not an unpleasant experience at all. It's hard to imagine that that's the case, but it's true. The recovery was not bad at all. I did not experience any what I would call significant pain. I would put it more at the level of discomfort. There were a few days, sleeping elevated, that's uncomfortable, but it all passes very quickly. And now that I'm 6 weeks out, it's all a distant memory, any of the minor inconveniences or discomfort. It has been, without a doubt, life-changing, which I was just saying to Dr. Clater. I feel more confident. And, just more me in my skin. We were looking at the before and afters and last time, and I said to Dr. Clater, the after is more me, than what my aging 59-year-old skin had developed to. That didn't look like me. Yeah. So it's a beautiful result. It's healing beautifully. Everyone here is lovely and wonderful. Do not hesitate. Come in and have your consultation.
You're so wonderful. You're so wonderful. Sometimes patients ask before we move to the actual stage of surgery what they should expect in the recovery. Can you share some of your thoughts about what that was like for you?
So I had very nice, supportive husband who helped me with the wraps. That's one thing that would be hard to do by yourself. Recovery, again, I didn't use a lot of pain meds. I had a prescription for Oxy and Valium. I think I used half an Oxy for a couple times a day for the first 2 or 3 days, and then I went to Tylenol, so I didn't need that. There was some swelling. The wraps are uncomfortable, but manageable. Honestly, 6 weeks out, it's already starting to be hard to remember the details. But, you get through it and it's not that bad. And quickly, within a few weeks, you start, things are well on their way.
Perfect.
Yeah.
So lastly, many patients will ask, is this something that you would recommend to a friend?
I would. I would recommend it to a friend or anyone.
Perfect. Well, thank you for sharing your story.
Thank you, Dr. Clater, so much.